So we are here for a webinar on public health action to transform food systems and advance food justice. And this is a webinar by the National Collaborating Center for Determinants of Health. And if you are with us today, it is November 26, 2024. And we welcome you and we hope to have a great conversation with you. My name is Pema Mazumdar. I use she, her pronouns, and I'm speaking to you today from Tshaka, known as Montreal, on the unceded lands and waters of the Kanien'kehá:ka Nation. I'm a knowledge translation specialist at the National Collaborating Center for Determinants of Health, which is now known as Antigonish, Nova Scotia, in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory, as you may know, is covered by the Treaties of Peace and Friendship, which were first signed with the British Crown in 1725. And those treaties did not deal with the surrender of lands and resources, but recognized the Mi'kmaq and the Wolastoqiyik title and established the rules for what was meant to be an ongoing relationship between nations. And it's also for me important to acknowledge that at that time that those treaties were signed, that there was ongoing racial and colonial violence in Mi'kmaq and in Canada more broadly. Slavery was established in what is now known as Quebec, where I live and where I'm speaking to you from, through a royal mandate by Louis XIV in 1689. And in the years that followed, and when those treaties of peace and friendship were signed in Mi'kmaq, Black people were either enslaved or fleeing from being enslaved in what we now know as Nova Scotia. And you may or may not know, although I encourage you to find out more, that there are 52 historic African Nova Scotian communities within that province that is now known as Nova Scotia. Yet slavery was only abolished in the British Empire, including in what's now known as Canada, in 1834. So it's important for me to say this as part of our land acknowledgement because we're gearing up for a conversation on food systems and food justice. And that conversation is really grounded and informed by the history and legacy of ongoing colonial and racial violence, and how we can, through this work, disrupt that. And there's been some great work worth highlighting that's taking place in what's now known as Nova Scotia, which you'll hear about later during this webinar, or that we can link you to in the chat box. And hopefully you'll tell us about some of the other work that you know of. So without further ado, I want to move us forward a little bit. We are the National Collaborating Center for Determinants of Health. We support the public health community to address the structural and social determinants of health. And our whole goal, what we'd like to bring about at a societal level is, and this is for my center specifically, the NCCDH, to bring about improved population health and reduced health inequities. You can learn about the other national collaborating centers. There are 6 of them. You'll see them here on the slide. You might be already familiar with their work at nccph.ca. So we've designed our webinar today with the intention of supporting you to describe the major components of food systems, including the food supply chains, people, institutions, food system drivers and outcomes, explore the connections between industrial food systems and health inequities in the Canadian context, and identify public health action to advance food justice at local, provincial, territorial, and national levels. So at this time, I think it's probably important to tell you that I am not the kind of person who is supposed to be presenting this work, but I'm standing in for a colleague. Her name is Diane Oikel, and I'm here with Bernice Yanfel, who is one of your wonderful presenters for today, and is sort of here to take over from me as your host and your opener. And Bernice, I thought maybe I'd just turn it over to you and let you introduce yourself. And Diane is unfortunately out sick, and we just wish her a speedy recovery.
Great. Thank you so much, Pema. So hi, everyone. I'm Bernice Yanfel. I'm also a knowledge translation specialist at NCCDH. I live and work in Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. So today's webinar is based on content from two products that I co-authored with my colleague Diane, who unfortunately couldn't be here with us today. The first product is a food systems issue brief, which explores what food systems are, why they matter for public health policy and practice, and how industrial food systems in particular contribute to health inequities. So you can find the QR code to access the issue brief here on the slide, and my colleague will also link to it in the chat. The second product, the Food Justice Practice Brief, will be released in the new year. And this product is about how a focus on food justice can help build healthier, more sustainable, and just food systems, and concrete action steps for the public health community to take to support food justice at different levels, including municipal, regional, provincial, territorial, and Canada-wide levels. And so you can look forward to that product. It's going to be released early in the new year. So you'll hear us reference both the issue brief and the practice brief throughout today's webinar. So the outline for today's webinar is as follows. First, we'll go through core concepts, answering the key question, what is a food system? This will be followed by an overview of how industrial food systems impact health in the Canadian context and contribute to health inequities. Following this, we'll talk about how food justice offers a solution to food system problems and highlight some examples of food justice in practice. So then there'll be some time for questions and we'll close around 1:15 p.m. All right, so now I'm going to pass it off to Pema, who will lead us through our first slide of WOOL.
Hi there. Hopefully everybody can see this. So we like to do these polls that just get a little bit of the interactivity level up and we get to hear from you. And if you've done this before, then you know what to do. You can scan the QR code. You can follow the link that's in the chat box. And if you've never done this before, then I encourage you to just click on that link or scan the QR code with your smart device and enter a word that you think of when you hear the word food system. Some people might enter more words like this first one: production, disruption, distribution, consumption, complex, interconnected, interconnectedness, farm to table, food to fork, seed to table, the channels that food go through before reaching us, everything involved in food, cooperation, corporation, interdependent, Indigenous food sovereignty. Ooh, they're coming in so fast. It's great. Okay. Indigeneity, capitalism, mutual aid, sovereignty. How we interact with food, grocery store, transport. Okay. I think there's a lot of, I have to do this joke, food for thought here. That's just for Bernice. She likes my corny joke.
I do. That was an excellent joke. 10 out of 10.
Are we ready to move forward now with, or do you want to comment on anything that you're seeing, Bernice?
No, that's great. I really appreciate the comments and words that I'm seeing. Definitely, all of those things are related to the food systems. That's great that we've had a chance to think of some words, and then now we're going to dive into some core concepts a little bit more. The next slide,
Great.
please. Great.
Taking its time. There we go.
That's okay. All right. So thank you so much for participating in that. So as I mentioned, I'm now going to talk about some core concepts to frame our conversation today. So what is a food system? So in the issue brief, we describe a food system as the webs of activities, people, institutions, and processes that bring food from the fields, forests, and waters to our plates and beyond. Ultimately, you can think of a food system as essentially everything and everyone involved in feeding a population. A food system is not only about the activities or steps involved in getting food to our plates, it's also about who is involved in those activities and the outcomes that result. Next slide, please. So in our issue and practice briefs, we use both the terms food system singular and food systems plural. And this is to recognize that what is known as a global food system is in fact a system of systems, meaning that there are many different food systems of different types operating globally, including in Canada. So there is no one singular global food system, but rather many interconnected systems. So the image displayed on the slide is a visual depiction of the so-called global food system and how it's organized. And you can see that it looks very complex, and that's because it is. The figure is meant to illustrate the various processes, people, and larger factors that influence how food is produced, processed, distributed, sold, and consumed globally. So we can think of the food systems or food systems as consisting of three major components: the food supply chain, people and institutions, and drivers and outcomes. And I'm going to go through each. So the food supply chain refers to the different stages through which food travels from food production to waste and disposal. It includes production, processing, distribution, consumption, and disposal of food. And these processes are displayed in the outer circle in the figure displayed on the slide that comes from the issue brief. And I'm sure many of you, if not all of you, have heard of the term food supply chain before. So food supply chains can vary in length and be long or short. A short supply chain means that food travels a relatively short distance or involves few what are known as middlemen in its journey from production to disposal. So a short supply chain means short distance or very few people involved in its journey from production to disposal. So an example of a short supply chain would be a grower of Ontario apples selling their produce directly to consumers at a local farmer's market. There are also very long food supply chains. Think here of the example of supermarkets relying on global imports of bananas from Central and South America. That would be an example of a long food supply chain. Second component, people and institutions. So food systems also consist of all the people and all the institutions involved in feeding a population. So these include the people and companies who sell the inputs for use in food production, like machinery, seeds, fertilizers, and pesticides. They also include farmers and farm workers, retailers, and food services and consumers. Ultimately, because we all eat food, we're all part of the food system. And thirdly, drivers and outcomes. The last component of food systems that I'm going to talk about today are drivers and outcomes. So many definitions of food systems leave this component out, but there are other more holistic definitions, which we've adopted here, that see drivers and outcomes as part of the food system itself. When we say drivers, we are referring to the different factors that influence how food supply chains are implemented and function. These include different political, environmental, and social factors, such as globalization, trade, food policies, urbanization, and more. Outcomes are the effects and impacts of food systems, include, for example, food insecurity, malnutrition, chronic diseases, and inequities in these outcomes. Importantly, drivers can be outcomes and outcomes can be drivers. For example, climate change is a driver because it can affect how much food is produced. Climate change is also an outcome of food systems because the way we currently produce, distribute, and consume food contributes significantly to greenhouse gas emissions and therefore global warming. So that just gives you a bit of a quick overview about what food systems are and how they function. It's really important when we talk about wanting to make food systems change that we understand our current food systems. And so that's some of the reason why it's important to give that background. So in our issue brief, we focus specifically on the impacts of industrial food systems. Industrial food systems are the dominant type of food system in Canada, through which most of us get our food on a daily basis. So these systems rely on fossil fuels and are controlled by large corporations at all points along the food supply chain. Industrial food systems are all about producing as much food as possible as quickly as possible. And to make that happen, they rely on heavy machinery, advanced technology, and large amounts of pesticides and fertilizers. So the industrial food system in Canada is embedded within a broader system of capitalism that prioritizes profits for large farmers, corporations, and their shareholders, often at the expense of people and planet. So displayed on the slide are pertinent facts and figures on the industrial food system in Canada that illustrate some of the challenges and inequities within the current system. So for example, every year, food and beverage companies spend about $600 million in advertising for what tends to be ultra-processed foods. And we know about the health problems linked to increased consumption of ultra-processed foods, including chronic disease. As another example, even though food prices continue to rise, compromising food security for so many, in 2023, the top grocery stores in Canada, including Sobeys, Metro, and Loblaw, which has admitted to fixing the price of bread, experienced record profits of $6 billion. So there's something clearly wrong with a system that delivers such uneven and inequitable outcomes. So before we talk about how industrial food systems impact health and what we can do about it, I'm going to pass it off to Pema for another poll.
Thank you, Bernice. So I'm going to just admit to everybody that, does anybody have it when your Zoom screen just disappears? It disappeared. So I was trying to find, where's my face? Anyways, in the middle of all that, please start this poll. I can see some good words coming in. Negatively, adverse health. This is one word to describe how food systems impact health. Now, again, we see a few words in some of these sentences, but some people are sticking to this one word thing, which is great, and some people are not, which is also great. Negatively, significantly are coming in really strong. Inequitable access, development of children, access to nutritious foods. What else am I seeing popping up as coming in more often? Okay, here we go. We're getting some bigger letters, which means that more people are putting in those words. So food insecurity, inequity, mental health, cancer, negatively, and then inequitable and inequities, and inequity. So I'm putting those together because they're kind of synonyms. One word to describe how food systems impact health. So that's a pretty good cluster. And the biggest word is significantly, that they impact health pretty significantly, but with some injustice and inequity. All right. Thank you so much for participating in that.
Yeah, thank you so much. Absolutely. And I think a lot of the themes that appear in this word cloud are things that we're going to pick up in our conversation. So next slide, please. So the issue brief that I mentioned brings together literature from 42 peer-reviewed and gray literature sources. And through that literature, we identified 5 related themes, or what we call pathways, through which industrial food systems contribute to health inequities with a focus on the Canadian context. And so these pathways are non-exhaustive. Clearly there are other mechanisms or other ways through which industrial food systems impact health inequities. However, these were the most common ones that came up in our review of the literature. So the 5 are: 1, precarious employment and hazardous working conditions; climate change; disruption of Indigenous food systems; food policy shaping food environments; and food advertising. So today we're going to highlight 2 of these pathways. Number 1, precarious employment and hazardous working conditions; and number 4, food policy shaping food environments. So the first pathway we'll discuss is precarious employment and hazardous working conditions. So we have a few resources that we've produced as a center that dive deeper into what precarious employment and hazardous working conditions are and how they are a significant public health issue. And my colleague will provide a link to one of them, the Decent Work Issue Brief, in the chat. To summarize, by precarious employment, quoting the Decent Work Issue Brief, we mean low-wage, temporary, or casual jobs with uncertain hours and income, and with few or no medical benefits or paid sick leave. And working conditions refer to the exposures that workers face while on the job, such as those related to physical, chemical, biological, and psychosocial hazards. When it comes to the food system and how it's designed and operates, migrant farm workers are made particularly vulnerable to both precarious employment and hazardous working conditions in Canada. So many migrant farm workers in Canada come to Canada through a program called the Seasonal Agricultural Workers Program that allows Canadian farm employers to hire workers from Mexico, Jamaica, and other Caribbean countries on temporary visas to work in agriculture. In 2022, there were over 70,000 temporary foreign agricultural workers in the country, a record high, which shows how important these workers are to the Canadian food system. But at the same time, they continue to be denied rights and other protections to safeguard their health. For example, it is very difficult for workers within these programs to apply for permanent residency status, which compromises their access to labor rights, healthcare, and income supports. They are also exposed to a range of occupational hazards, which are summarized in the table displayed on the slide. These include hazards related to the exposure of pesticides and excessive heat. A unique hazard that migrant farm workers experience is fear of deportation, a psychosocial hazard. Because under the Seasonal Agricultural Worker Program, migrant farm workers are granted employer-specific entry visas. This means they cannot change jobs easily. And as a result, research tells us that many migrant farm workers are afraid to speak up about poor working conditions for fear of having their contracts be terminated and them being deported. Workers within these programs have also reported poor housing conditions, denial of medical care, inadequate training and protective equipment, as well as racial discrimination. All of these things working together to compromise their health and well-being. We're now going to play a short clip for you. This is from our podcast, Mind the Disruption. It's featuring Sarome Rowe, who's an organizer with the organization Migrant Workers Alliance for Change. In the clip, she'll be talking about some of the challenges that migrant workers experience and the constant threat of deportation and termination of their contracts.
A group of 7 women from Jamaica were working on a strawberry farm in Nova Scotia. Mm-hmm. And in the agricultural sector, it's known that strawberry picking is some of the hardest and backbreaking work because you have to be on your knees the whole day. It's also piecemeal work, which means that you only get paid for how many strawberries you are able to pick. Mm-hmm. They were working for 3 months every day without a single day off. And in this industry, workers are allowed 1 day off every 6 days, unless there is an emergency situation. And in this farm, the employer said that it was an emergency, and our members were forced to work 92 straight days in the heat on their knees. And just from sheer exhaustion and dehydration, they collapsed, and one called an ambulance. They went to the hospital where they were treated with an IV drip. Mm-hmm. And 2 days later, when they got out of the hospital and, returned to work, they came back to the farm and their bags were packed. They were being deported.
So I think in that clip, Sarome does a really powerful job of describing some of the conditions and the nature of precarious employment that migrant workers are facing. And the sources that we profiled in our issue brief describes how those conditions and precarious employment are linked to poor health outcomes among migrant farm workers. So that just gives you a brief illustration of one of the pathways that we explored in our issue brief as it relates to how industrial food systems impact health inequities in the Canadian context. And here's just a screenshot of some of the sources on migrant farm workers we profiled in our issue brief. And you can find the full list and summary of each in the published document. So the second pathway connecting industrial food systems to health inequities that we're going to talk about is pathway number 4, food policy shaping food environments. And by food environments, we mean the places and settings where people make decisions about food. For example, the home, school, workplace, and grocery store settings. And also what foods are made accessible and desirable in those settings and for whom. So food environments relate to questions like where grocery stores are located, what their density is in different neighborhoods, the types of foods are available in those places, also how much they cost and how they're advertised and marketed. Food policies are critical in influencing food environments, as captured in the chart on the slide. For example, a ban on artificial trans fats has affected the types of foods that are sold in Canada. Ultimately, the presence or absence of food policies helps determine whether food environments help promote health and justice and for whom. The food industry in Canada is very interested in affecting food policies so that they can help create food environments that allow them to sell more of their products and therefore boost their profits. This influence can have significant impacts on health, especially for those already facing inequities. Next slide, please. So for more about how the food industry tries to influence food environments and the Canadian food system more broadly, let's take the example of Canada's Food Guide. So Canada's Food Guide is a resource that's integrated into many food-related policies and programs in Canada and is instrumental in help shaping our food environments. In 2019, Health Canada released the revised version of the Food Guide, advising people to, among other things, eat a variety of healthy foods every day, use food labels, and limit highly processed foods. But before the food guide was released, there was a lot of effort by the food industry to influence the contents of the guide. So these efforts were studied in a really interesting report by researchers from Université de Montréal and an institution in Dublin, Ireland. What they found was that food industry organizations like the Canadian Juice Council, who represents manufacturers like Tropicana, Minute Maid, Welch's, they undertook various strategies to try to shape the guide according to their own corporate interests, what the authors termed corporate political activity. These strategies are summarized on the slide, and this included, for example, information management through submitting briefs during the consultation period about the guide that put into question established scientific evidence on food and nutrition. They also engaged in discursive strategies by claiming, for example, that there would be unanticipated costs to public health as a result of the proposed changes to the guide. They also engaged directly in lobbying efforts and sought to obtain support from other community organizations who would join them in opposing the proposed changes. However, ultimately, the authors report that despite their best efforts, there is little evidence that the food industry was actually successful in significantly shaping the guide. But so often that's not the case. And we know that globally, the food industry has been able to interfere with the development of food policy, which matters for health and well-being. Pam is now going to lead us through our next poll. I'm really interested in hearing from you about what are some examples you know of how the food industry has tried to influence the food environments and the food system more broadly.
Yeah, so I can see one participant typing already. And the question, of course, is when you think of the food industry influencing food systems, what examples come to mind? So we have some ideas coming in here: vending machines in schools, marketing to children, sugar in beverages, influencing advertising standards, inflating costs, health halo. I don't know what that means. Oh, is Halo one of the video games, maybe? This shows you how much I play video games. Food waste, mislabeling, misleading labels, capitalism, toxic food additives, pesticides in food production, biased information. What we can access is controlled by the system. Okay, great. So much in here. Partnering with food banks like they are heroes. Sports team sponsorships. Subsidizing certain food industries, changes to zoning laws. Profit margins for ultra-processed foods. Labeling some traditional foods as superfoods, driving their use up, but in a co-opted or appropriated way. The wording has disappeared from the screen, but that's the gist of what I think I saw. Allowing diet culture, pushing cheese and beef. Advertising and promotion, lobbying, shrinkflation, that's a new word to me. Farmers being tricked into growing GMO, hidden toxic ingredients. Okay, there's a lot in there. I read out a few, so hopefully everybody was able to follow along and catch them as they floated on their screen. You can keep participating if you have more, and that way we'll have something to look through after the webinar in our own, in our Slido account, and we will share it back with you as it might be of interest. Okay, I'm going to move us to the next slide.
That's great. Thank you so much. So to sum, based on our analysis, we found that there are a number of ways or pathways through which industrial food systems including the corporate actors operating within them, contribute to health inequities in the Canadian context. And as such, there's an urgent need for healthier, more sustainable, and just alternatives. So, what is the solution? Well, that's where food justice comes in, which is the focus of our practice brief. So, we're now going to do another quick poll around your understandings of food justice.
Great. Thank you, Bernice. And thank you to the people in the chat box who are helping to explain some terms to me, like health halo and shrinkflation. That's really great. Thank you, Mary Ellen and Cheryl. So what are some elements of food justice? Well, coming in strong at the top, we have racial equity and justice. Oh, something just got bumped. Dignified access to food, racial equity and justice, and workers' rights and justice. And 32% of people are saying corporate activism. All right. Bernice, what do you think about these answers?
Great.
What are they telling you?
I think it's telling me that we have a lot of people here who are already familiar with food justice, which is great. So I see dignified access to food has been answered as a response by 85%. That's wonderful. Corporate activism, I see 28% there. And so certainly that's something that food justice tries to contend or deal with or challenge. So that certainly comes into it as well. Yeah, so I think these are all great responses. Thank you so much for your answers. So before we go into some examples of how food justice can and has been promoted, let's talk about what it is. So what is food justice? So I'm sure many of you have heard that term before. You might have heard different definitions for that term. And that's because there's no one consistent definition of food justice. It has been defined in many ways. And in many ways also, it is very context specific. So how one community defines food justice may differ from how another community defines it. So even though there's that contextual specificity, there are also some like overarching ideas or elements that we can think about. So in our practice brief, we describe food justice as a social movement, approach, and set of principles that recognizes food as a human right, has an explicit focus on racial equity and justice, works to dismantle the barriers that prevent all people from having enough nourishing, affordable, and culturally relevant food, and intimately links food systems to public health. So the idea of food justice can be broken down into three interconnected dimensions: distributive justice, procedural justice, and recognitional justice. Distributive justice is about everyone having their fair share. So when it comes to food justice, it's making sure that everyone has access to nourishing, affordable, culturally relevant food at all times, and that food growers have the resources they need to produce food. Procedural justice is about making sure people are having a fair say, meaning they're able to take an active part in informing decisions about their food systems. So that's procedural, fair say. And recognitional food justice is about equal respect, making sure that people's knowledge systems, values, and traditional ways of producing and consuming food are respected and protected. So why is a food justice approach important to public health policy and practice? So in our practice brief, we talk about the linkages between food justice and public health practice and policy. And so there are a number of reasons why a food justice approach can contribute and enhance and is also important to public health policy and practice. And we've highlighted a few reasons here. One, food justice centers racial equity and justice, which is a lens that is either absent or minimized in many other approaches that seek to address food system challenges. Because racism is so intimately intertwined with industrial food systems in the past and present, as we can see with the example of migrant farm workers, a focus on racial equity and justice is absolutely critical to building better food systems. Two, also adopting a food justice approach means in part considering how different factors and determinants like racism, settler colonialism, and economic oppression come together to influence food-related health outcomes. Therefore, that focus makes it very well aligned with public health actions to address the structural and social determinants of health. And if you're wanting a bit of an orientation or introduction to the structural and social determinants of health, we can link to a document that we recently published on the topic in the chat. It gives a really good overview of what those terms mean, how they've evolved over time, and some really concrete examples for you to think about. Thirdly, when we link food justice with other issues like housing justice, climate justice, et cetera, it fits very well into a larger scope of public health work on health equity and justice. So in our practice brief, we identify 8 principles of food justice that relate to the 3 dimensions I spoke of earlier that can serve as action areas to plan and implement food justice work. I won't go through all of them today, but I will highlight a few. So number 1, dignified access. This is about working to ensure that all people at all times have dignified access to food that is nourishing, affordable, culturally relevant, and also have the resources they need to produce their own food. And that word dignified is really important because we know that many of the food charity models, they don't necessarily lead to dignified provision of food, though they're filling important gaps in terms of emergency food provision. So food justice is really about ensuring dignity in terms of how people are able to access food. There's also ecological sustainability. So that's about ensuring that the way food is grown, harvested, processed, transported, and consumed protects natural resources and supports the well-being of future generations. And it considers things like food waste, ways to reduce food waste, sustainable forms of food production, etc. Also, racial equity and justice. So this involves in part confronting past and present harms like gentrification that have contributed to present racialized food inequities. And labor justice and rights is also critical. And this means in part making sure that all workers are given fair wages and fair labor practices are in place. Other principles we have highlighted include people power, and that is all about making sure that decisions about food systems are made by people for people. So it's about reducing corporate involvement in the food system and decisions about food systems. And we also have social justice solidarity there, which means connecting to other justice issues and embedding food justice and work on other related issues like climate justice, housing justice, et cetera. Next slide, please. Yes, and also, so I had mentioned that people power is about making decisions for people, by people, and also with people is very important. So thank you so much for putting that in the chat. I appreciate that. So over the next few slides, we're going to highlight a few examples of strategies that have and can be undertaken in support of food justice. So the first is healthy school food programs. This was actually the focus of my doctoral work. My research focused on the school meal program in Ghana, and I was looking at how that program can help support food sovereignty, which is a concept that is very closely related to food justice. So these programs involve the provision of meals to children in school settings. And recently, the Canadian federal government released the National School Food Policy, which promises increased investments in in school food programs around the country. So there's lots of potential for public health to support these programs in different ways, including in terms of the design and implementation of these programs. And these programs also have lots of potential to support food justice. So what you see on the slide is how school food programs can connect with different principles or elements of food justice. So for example, by providing children with culturally rooted meals, linking with local growers and producers, and integrating elements that provide children with the opportunity to develop critical food literacy. So as a second example, I want to highlight here the Just Food Action Plan from the Halifax Regional Municipality. This action plan was created with participation from public health partners and involves over 50 recommendations for positive food systems change. We're now going to play a podcast clip from an episode featuring Wendy Wilson and Nikia Paris, who are both descendants of historic African Nova Scotian communities. In the clip, Nikia will be talking about the creation and purpose of the Just Food Action Plan and her involvement as part of the African Nova Scotian and Black Food Sovereignty Working Group.
So I want to take you back to the beginning of the whole amazing Just Food Action Plan that the Halifax Regional Municipality has been partnering with community to implement and move forward. So I think it was March 2023, Halifax Regional Council endorsed Part A of the Just Food Action Plan. And so Part A sets the stage for really a regional food system, right? It captures the public engagement findings that they had. And from that, a set of 56 recommendations for positive food system change were developed. The whole goal around Part A is to function as a living and breathing document that will be monitored, evaluated, and refined by community and plan partners over time. And so as Part A got endorsed, there were different sets of what they were calling Just Food working groups established to continue to move Part A forward, but for a more specific or localized lens. For example, there was an Indigenous Just Food working group and the African Nova Scotian and Black Community Just Food Working Group. As the African Nova Scotian and Black Food Sovereignty Working Group, our main goal is to honor and embrace the right of Black people to have healthy and culturally appropriate food produced through ecologically and sound and sustainable methods for our community members. And that really includes the right for us to define our own food, our agricultural systems, and to build our own institutions to advance our community's capacity and resilience for access to food. So really, we want to focus on being able to create food that's for us and by us, and that's acceptable and accessible to all of us.
And so if you want to learn more about the Just Food Action Plan and the over 50 recommendations, as well as the recommendations specific to African and Black Nova Scotian communities, please feel free to click the link in the chat. And also you can listen to the episode for more information. Great. All right, so as a third example, I want to highlight the Toronto Black Food Sovereignty Plan, released by the Confronting Anti-Black Racism Unit of the City of Toronto. I'm involved in an advisory capacity in terms of this plan. And as I mentioned, food sovereignty as a concept is very closely related to food justice. And I know that a question has come up there, so we can talk about that a little bit more. So this plan is community-led, and it's intended to improve the health, well-being, and capacity of Black Torontonians, identifying 5 pillars for action. So these include sustainable funding and community capacity building, access to growing space, accessible infrastructure, Black food hubs and cultural markets, and culturally rooted community health and nutrition programs. And so we've also added a link in the chat so you can learn more. So these are just 3 examples of innovative food justice work. What you'll notice with both the Just Food Action Plan as well as the Toronto Black Food Sovereignty Plan, they're created with community. And that's a really key part of food justice work. It has to happen with community to understand community priorities and needs. And so they provide some really good examples of what food justice can look like in practice, and also public health involvement in terms of that work. So we highlight many more examples in our practice brief. And also, as I mentioned, in the practice brief, we identify some concrete action steps that public health organizations and practitioners can take to promote food justice around those 8 principles that we discussed. So, for example, where it comes to ecological sustainability, we talk about working with organizations, community members, partners, to think about ways to reduce food waste, including activities around prevention, including but not limited to advocating for a pan-Canadian food loss and waste target, actions around disseminating information around differences between best before, use by, and expiry dates for food, which is a major cause of household food waste. So being involved in dispelling some of that misunderstanding there. These are some important actions that public health can take in terms of supporting ecological sustainability, which is an important pillar or important principle of food justice. So some other actions we've highlighted include working with planners and other government officials to think about how public spaces can be used to grow food and using different measures to protect growing spaces like zoning policies, removal of private development rights, so on and so forth. So as I mentioned, that practice brief will be coming in the new year. And once you've had a chance to access it, we'd love to hear what you think and how you're able to use it in your own food justice work. So what we're going to do now is transition to the last poll. We want to hear from you about some examples of local food justice work that you might know of and that you potentially have been involved in yourself.
Yeah, so we're just waiting for some examples to come in. And as you were speaking about those examples, Bernice, I found myself wondering, exactly this question. What are some other examples of local food justice work that the many minds who are part of this call and this webinar have heard of or have potentially been involved with? So we're seeing here advocacy, dietitians for food justice advocacy group, community farms for equity deserving groups, Black Creek Community Farm. So if you're writing and you still haven't entered, I'm wondering if you can just add maybe the province or the city that this work is from. That would maybe help give it some context. Some of it I recognize, like Black Creek, I know is in Toronto, in Ontario. So here we're seeing Senior Connex in Foothills County, Alberta, Just Food Action Plan in Halifax. So that was not new to whoever wrote that. Seeds of Change in Surrey, BC, Land Back and Mutual Aid BC, Hamilton, Ontario, Community Fridges, African Food Basket in Ontario, Ensuring Good Working Conditions for Temporary Foreign Workers in Manitoba, Free Food Markets in BC, seedsofchange.org, Food Sharing in Ottawa, Food Support Hub in Burnaby, Maloka Community Garden at York University. Yeah, and I'll try and find the link. I was just before this webinar listening to another recorded webinar from TMU, from Toronto Metropolitan University, on a green rooftop initiative and some Black food sovereignty work there, which might have been related to what you shared a little bit, Bernice. They mentioned the Confronting Anti-Black Racism unit as well at Toronto Public Health. So that's great. There's so much coming in here. Ontario Dietitians in Public Health, the Vancouver Neighborhood Food Network, Lived and Living Experience Advisor Group in Newfoundland. So wonderful. Thank you for sharing all of those. There's a local coalition in Northwestern Ontario that somebody wrote about. And I'm wondering if you have more kind of context that you want to share, continue to write in the chat box. Tell us whether or not, from those of you who are joining from a public health unit, if your health unit or regional health authority is involved with this kind of work, or if it's you personally kind of on your own time. If you see opportunities for how public health could be more involved, you can put any of that sort of chatter on the side in the chat box. We'd love to hear it. Okay, back to you, Bernice.
That's great. It's so amazing to see so many examples pop up on screen, some of which I'm familiar with, some of the examples I'm familiar with, and many of which I'm not. So I'd love to learn more, hear about the amazing work you're doing. And yeah, there'll definitely be opportunities moving forward to profile some of that work. Once the practice brief is released in the new year, there are some plans to have some further conversations and sessions around some of those concrete action steps for the public health community to be involved in promoting food justice in different contexts and at different scales. So this is certainly a conversation that we're planning to pick back up in the new year.
Bernice, what would be the best way for folks to let you or Diane know if they have work that they think is worth profiled or they'd like to get in touch to share more?
Oh, that's great. Thanks for that. I think the best way would be to probably contact the DH email address so we can make sure that it gets to the right person. And then we'll definitely think of ways that might happen. We certainly are planning additional, webinars and the like. We have a podcast, as we mentioned, so that is certainly a possibility as well. So there are lots of different ways. But I think profiling that work so people know what's happening, how to connect with others who have common interests. I think that's a really key part of, building a food justice movement and working together. So we definitely want to hear from you about what you're involved in. Great. And just to add, with the practice brief that's going to be released in the new year, we've also embedded, in addition to these action steps and practice examples, we've also embedded some critical reflection questions for you to think about as you are planning your food justice work. So that will be something that will also be helpful as a tool to guide you in your efforts. So thank you so much. I think now we're going to transition into a time for questions. I know that we've received a couple already. I'm going to pass it off to Pema, who will be asking the questions.
Yeah, so we have received a few. I'm just looking at them as they're coming in here. So maybe a good one to start with. Sorry, I'm just waiting for it to load here. So Natan, I hope I'm saying that correctly, Natan Levy is asking if you can please talk a little bit about the differences between food justice and food sovereignty, if you have some thoughts on that.
Yeah, absolutely. I do have a lot of thoughts. This was one of the focus areas of my doctoral work and understanding some of those distinction and points of overlap. I think the overall message is that food justice and food sovereignty as concepts and movements are very much related to each other. Where they differ is where they originated and also slightly different places of emphasis. So, food sovereignty is a movement that comes from the global south, Latin America in particular, and among peasant farmers. When it first originated, it was very much about land ownership and rights, peasant rights, so on and so forth. Food justice is of United States origin among Black communities in the United States. And so that origin is different. And also, there's slightly different points of emphasis. And so, some scholars or researchers would argue that food sovereignty is about remaking the entire food system, so building it from the ground up. So, completely removing all of the capitalist logic, the neoliberal logic, and thinking about different ways to imagine our relationships to food. And they would say that food justice, in contrast, is about making tweaks or making changes within the existing system to make food more accessible, more culturally relevant, et cetera. But that is continuing to shift and change. And many people now are using food justice and envisioning it as a more transformative framework as well. So, like I said, they're closely related, but they have different origins and slightly different points of emphasis. And I can also link into the chat a really good resource that talks about some of those differences that you might find helpful. Does that help? Does that answer your question?
Well, it certainly explained it to me.
Okay.
I want to know more. And I've enjoyed so much hearing from you in this webinar and reading the issue brief. And so I just want to give a little personal appreciation. It's been great to have a bit more of a deep dive into these concepts and ideas.
Mm-hmm.
Okay, next question that we're going to take is from Elise Leong Sit, and I again hope I'm saying your name right. She asks, what is your opinion on the role of creating separate, often smaller scale food systems like community gardens, in contrast to changing or decolonizing larger scale food systems? So large scale food production, distribution, and economic systems. And I think you and I have talked about this a little bit, Bernice.
Yeah. What are your thoughts, Pema? I'm curious. Yeah, because we've had a couple of conversations.
I mean, I'm certainly no expert, but I think
Mm-hmm.
that I would say this is a both and situation.
Mm-hmm.
The smaller scale food systems like community gardens and rooftop, I don't know if rooftop would be considered one of the smaller scale initiatives, like green roofs,
Mm-hmm.
that they are a larger part that put together all of that builds can work to do so many different things. It can build interconnectedness between participants, and particularly if it's for example, a Black-led rooftop initiative tied in with connecting people who have often been dispossessed, disenfranchised, and excluded with with other aspects of the larger community, with the larger food system, and really as a way to build those bridges and connections and restore justice in so many different ways and interconnectedness, and bring cultural food safety and competence into the mix. I'm using probably not the right exact words, but I think that those little initiatives can add up to make a big difference in a community and then in a larger scale. And I also think that we can't shy away from larger scale policy initiatives and larger scale work. So
Yeah, I think that's really important. I agree. And I think some of those smaller initiatives can also serve as models for larger systemic change as well. So I think there's something to be said to your point, Pema, of both and. So it might be that community garden itself is not enough to transform food systems, but at the same time, it's building, things that are important for health and well-being, like social connectedness, right? Food skills, et cetera. So I think those things are important, but in and of themselves, they're not enough.
thanks, Bernice. So a few more questions have come in. I'm just going to scan them to see if there are some similar ones there. There's a question about taxation and subsidies and the role that those play, like sugar taxes, farm subsidies, in shaping food systems and promoting food justice. Do you have anything to say about that, Bernice?
I'm not an expert on taxes and subsidies, but there's certainly some literature that I've read on the topic and the potential impact of taking the example of taxes on sugar sweetened beverages, for example. There's potential impact for those taxes to potentially worsen inequities. So I think when we consider those policies, we need to really be mindful about what those equity implications are. And actually, one of the actions that we've highlighted within the practice brief is for public health to do some of that work in terms of considering what are the impacts of these policies on food justice, on health equity. So I can link to more information there, and you're welcome to do more looking into that. But that's certainly a relevant and important topic.
Great. Thank you, Bernice. And from the same person, from Franklin Frew, we have a question on that I think might be useful for everybody. And even if we don't have all the answers, what we can do is point you towards one of our sister centers. So what strategies have proven effective in engaging policymakers to support food system transformation at the local, national, and global level, or global level?
Mm-hmm.
Strategies for engaging with policymakers around this food systems transformation.
Yeah, I think that's a really good question. One resource that I think we should point people to in terms of this question, it's our power resources, because they talk specifically about strategies in terms of influencing change and which ones are more likely to be effective. So things like coalition building, working with community organizers, et cetera. Those are all things that are important to consider. I think one of the major messages is that evidence itself is not enough. So you might have the best evidence, right? And you think that in itself would be enough to convince policymakers, but that's often not the case. And there are other strategies that are needed, including but not limited to relationship building, et cetera. So we're going to link to that resource for you to learn more.
Great, thank you, Bernice. And another, I mentioned the Sister Center. So there's an NCC specifically on healthy public policy, and they really feature a lot of resources on engaging with policymakers, different strategies for that. So deliberative dialogues, ways to get policymakers to hear, to connect municipal action with larger policy action. So I encourage you to check out that center as well, because a lot of those resources could be used for action for food systems transformation. And that's nccdhpp.ca. Okay, we have a lot of questions, so I'm kind of picking and choosing. And what I can say is that if you're still curious, or if you really have other burning questions for Bernice and for Diane, do write us at nccdh@stfx.ca, and we'll go through a few more. So there's a question from Sorry, 1 second here. There's 2 questions on land and housing. And again, Bernice, if you have any thoughts on this, feel free to share. So the first one's from Donna Whitman, and she says, thanks for this presentation. Can you comment on the issue of the need for land for housing and the need for land for food production and processing? And Natan is asking about land reform. Given our settler colonial state, does food justice look to transform land ownership? With capitalist land ownership, how can we have just food systems?
Just to start,
Fix them both.
Right. Just to start with the last question, I think that is the crux of the issue in the debates when it comes to food justice, what we're trying to achieve, and the possibilities or potential for that. And so I think what Natan, you touched on is what some people might argue are the distinctions between food justice and food sovereignty, where food sovereignty has an acute focus on land reform and completely transforming the capitalist state. Whereas food justice, again, as I mentioned, some might see as making more changes within existing food systems. So certainly the issue of land is incredibly important. I attended an event in London, UK recently on land and justice, and it was talking about ways to access land for food growing as well as for affordable housing, et cetera. And some of the debates and politics are embedded within those questions. So there are no easy answers, but these are the types of things that we need to contend with and consider when it comes to promoting both food justice and food sovereignty. So I'm happy I put a link in the chat around that, so for you to learn more a little bit about those issues. But that's certainly something that is of importance and something that is that needs to be considered in terms of, okay, if we're not talking about land reform, then what is the transformative potential of this approach?
Okay, great. Thank you, Bernice. That was a great answer. And it was a great question. So thank you very much for your question, Natan, and also Donna. Bernice, you're being asked about a pretty specific thing here. So I'm going to ask, you might not, hang on 1 sec. I have heard that food donations, this is from Callie Chiang. I have heard that food donations by corporations may qualify for tax breaks. How does this fit in with the food justice model? Would it unintentionally uphold the unsustainable practices by corporations?
Yeah, I think it absolutely can. On the topic of tax breaks, I would say that's not necessarily my area of expertise or something that I have too much information on. But I think certainly if, corporations are being incentivized to produce too much, then certainly that doesn't help to tackle issues around ecological sustainability. So I agree. I think that's a huge problem and potential area of action as well.
Great, thank you. So I think let's go to this chat box. So people have been sharing some pieces there as well. Jennifer May Hadford had a question about analysis of capacity. She said, I'm reflecting on the volume of food that is required to adequately provide for the population and the food production capacity of the population. Does analysis indicate that well, first of all, I think that the first question is, has there been an analysis of that capacity to your knowledge? And then the second question is, does that analysis indicate that financial resources could support smaller scale food systems? Would they be adequate? So if I'm understanding the question correctly, the biggest part of it is, do you know of an analysis of the sort of capacity of how much food is required to adequately provide for a population?
Mm-hmm. I know some analyses that have been done from a global South perspective on that question. What I'm understanding from the question that's being asked is that can small scale food systems produce enough food to feed everyone? And I think that's a question of ongoing debate. And that's something that's being constantly asked in the literature and in research, and there have been differing responses in terms of that question. And so I think one of the most powerful ways that our current industrial food system um, is able to kind of reproduce itself and continue to be the way it is through disseminating narratives or ideas that this is the only way that's possible to feed everyone. And so it blocks out the possibilities or the imaginings of alternatives. And so I think one of the major tasks in terms of a food justice or food sovereignty approach is to contest some of those dominant narrative and ideas and think about what alternatives could be. And so there are some really great scholars who are in that space. I'll mention one of them, Holt Jimenez. And there is there's a lot of good scholars in that space who try to break down some of those assumptions that we have in terms of our current food system, whether they're true and what some alternatives might be. And so I think that's really something important to think about.
Wonderful, thank you. Bernice, you're getting some nice appreciations both in the chat box and in the question and answer space. So thank you. I echo your appreciations for the wisdom and content and nuance that Bernice has shared here today with us. And there's a comment from Charlene Black here that I just want to echo here. It says most of the, oops, I lost it. Hang on one second. Most of the research on capacity for food systems to support our population is not uninfluenced or has been done with corporate interest. So I think especially as we think about things like the commercial determinants of health and how that sort of plays into our knowledge, the knowledge that is often coming to us in different forms, that's a great thing to sort of keep in mind as well. And another piece that came in was a book recommendation that speaks to this: Real Food, Real Facts.
That's great. I don't think I've read that one, so I'm definitely going to check that out.
So any other book recommendations or event notices, feel free to share them. I'm sure other participants appreciate them as well. And we tend to do a sort of roundup of what we've heard during a webinar and share it back with participants. So that's a great way for you to crowdsource from within who attended here. Somebody shared something coming up in February. Mina shared to build disciplined majorities capable of winning measurable victories through well-planned campaigns, and then a link. It's a course, I believe.
I also shared a link to one of my favorite books, A Foodie's Guide to Capitalism. And so the whole premise of the book is that, if you want to be involved in transforming food systems, then we need to first understand, how the global capitalist industrial food system works. And this author does a really good job of dispelling some of the myths related to that food system, understanding its functionings, why it creates the unfair outcomes it does. So if you want a very readable book on the topic, that's a great one to check out.
Great. I'm going to share one last question here, if it's okay. I think we have time for it, and I'm actually posing it more to all of you to answer in the chat box. Bernice might have an answer. She often has great answers for things, but it's what emerging trends in technology or innovation hold the most promise for transforming food systems in ways that advance public health and food justice. And I'll share something that I heard about at the Public Health Association conference in BC that just took place. And it wasn't technology in terms of a smartphone, but it was technology from mycelium, from fungi, and how an Indigenous First Nations community and some really amazing youth-led work in the Wet'suwet'en, which is a First Nations community in BC, and what's now known as BC, are using mycelium and fungi to restore the soil, to I'm going to say this not probably the right way, but to remove the toxins from industrial waste, from fossil fuel extraction, and to make the soil a more fertile place again. So it's an innovation, and I think it's worth looking into. So I'll see what I can find in terms of my links from that conference. And the Indigenous youth who spoke, her name was Drew Harris, and it was really amazing to hear about that. So if others have other innovations or technology they want to share, go ahead. And we look forward to hearing from you in the chat box and just keeping in touch in general with your ideas and your initiatives that you want to share. Bernice, did you have anything you wanted to add?
Just thank you, everyone. I'm so glad that we have such an active chat box. I've been learning so much as well alongside all of you. So it's been great. Lots of great resources shared. So thank you so much.
Great. And I'm seeing lots of hearts go up here and thumbs up and other kinds of appreciations. We wanted to ask you to do, I mean, you've been so engaged. I feel almost bad asking you to do a checkout, but at the same time, I feel like you will rise to this challenge and lean into it. If you have one word or a few words of a feeling that this webinar has left you with, or an action that you're going to take as a result of attending today or being with us today, please share it in the chat box. It'd be great to hear it. Okay, wonderful. Thank you all so much for being with us today. Thank you, Bernice. Thank you, Diane, for the amazing work. And we look forward to staying in touch with all of you.